Here's why resistance band exercises are making your knee pain worse. I have a major problem with resistance bands, and the reason is because it's often overdone. Exercises with resistance bands for knee pain are done way too much by healthcare professionals and fitness people. But let me be clear, if you're using resistance bands as part of your normal fitness routine, I don't have a problem with that. But if you're using resistance bands to heal knee problems, I'm not okay with that. And I have 3 reasons why. The first reason is because of the anatomy of the hip. Let me cover that with you just a bit. So here on the side of the hip, you have many glute muscles and abduction muscles or side of the hip muscles. And just to keep it simple, you have glute abduction muscles, which are the muscles that help you move your leg out to the side. And then you have extension muscles, the muscles that help you move your leg backwards, kind of behind your body. And then you have flexion muscles that make you go forward, and adduction muscles that make your leg go inwards. Those are some of the major motions of the hip. Some minor motions that we don't think about very much are rotation. Your hip can rotate in and out, and it's those same muscles that help to control this. Some muscles that I want to highlight to you are on the front, like where your front pocket would be. You have the tensor fasciae lata muscle. It's often abbreviated to TFL, and that one inserts into the IT band, which goes down to the outside part of your knee. And because it's more on the front, it's more of an internal rotator and even a hip flexor, but it absolutely does do abduction, or moving your leg outwards to the side. Then you have glute minimus under that, which is an abductor, out to the side muscle, and an internal rotator. This is going to make sense. I'll put it all together for you. And then you have medius, gluteus medius, which is mainly an abductor, a little bit of an extensor and flexor. Kind of does everything. It can also internally rotate and externally rotate. They split it into a front half and a back half. But then you have the big glute maximus, the one that everybody knows. And you have some deeper muscles to that. They all kind of share extension. They help your leg to move backwards, and they absolutely help in external rotation, or rotating your leg this way. This is important because when you do hip abduction exercises, moving your leg out to the side, which is usually what's happening when you're using a resistance band for knee exercises, you're exercising the muscles on the outside, and you're focusing on abduction, or outwards to the side motion, which doesn't focus on getting your glutes stronger. Because if you were going to focus on getting your glutes stronger, you should be moving your leg backwards, doing hip extension. Because in order to help knee pain, you've got to take pressure off the thigh and get your hip muscles stronger to control rotation. And if you look at the mechanics, when your leg starts to rotate inwards, which is what all those side of the hip muscles do, more on the front, you're going to use the front of the muscles more, and that's going to build up pressures in the knee and cause problems like ACL tears, chondromalacia patella, cartilage issues. Eventually it can set up things like knee osteoarthritis, and if you keep going, it might even set you up for a hip replacement later on in life. But if you focus on the muscles on the back side of the hip, like glute maximus, then there's a reflex in the body. It's called reciprocal inhibition. You don't need to know all those details. But if you get these muscles back here to work better, the glute maximus is the key one, then it kind of calms down the muscles on the front of the hip and thigh, which takes pressure off your knee, and it also sets up the bones to be in the right position. So just to review that point, if you're using bands to help drive your leg outwards to get the outside of the hip working, you're promoting movement in this direction, which focuses on the wrong muscles, because you need to be going in this direction to get the back of the hip. Which sets me up for point number 2. Our bodies, primarily, when you're walking, you're moving forward. You're going in a forward direction. Maybe occasionally you move backwards and you walk backwards, and probably even less so than that, you move sideways. Now there's definitely variations depending on if you do sports or what activities you do, but if we're just talking about your normal daily life, maybe you have a job, maybe you're in school, you're at home a good amount, whatever it is you're doing, you're probably walking forward to the next room, to your office, to your car. You're walking forward through a store, and there's not a whole lot of sideways motions happening. And if you're having knee pain and that's 95% plus of your life, it doesn't make sense to focus time and energy on doing exercises where you're moving your leg outwards, because most of the motions are happening forward and back. And when you're pushing your body forward, you need good glute strength in order for that motion to happen as neatly and as efficiently as possible. So why spend time pushing your legs outwards with resistance bands when you need to be instead focused on pushing your leg behind you to get the glute maximus muscles and the muscles right under the glute maximus to work as much as possible? Now I get it, sometimes fitness professionals are just trying to add another little layer to their exercise and get a little bit of the glute minimus involved, and that's okay. But if it's training more glute minimus than glute maximus, in other words, if you're getting more burn on the outside of your hip rather than on the back of your hip, you're kind of missing the mark. If you have a meniscus problem in your knee and you're trying to help it by getting your glutes stronger, I wouldn't focus on exercises that make the outside of your hip stronger. You need to focus on exercises that make the back of your hip stronger. That's going to set you up to normalize the pressures and fix the root problem that's setting up a meniscus tear so that you can avoid surgery and arthritis later on in life. And the third big problem that I have with using resistance bands for exercise with knee pain issues is that there's co-contraction happening. And that's a big word for all the muscles want to work when you're trying to do an exercise where you're really trying to focus on one or two muscles. And when we're talking about the hip, if you're doing a squat, for instance, you're trying to bring your body up and down, bending your knees and hips, and then you put a band around your knees. Banded squats is what I'm talking about. Ideally, on a squat, when you're coming up out of the squat, we want you to feel your glute muscles doing the majority of the work. But if you have a band, if you have weights on you somehow, whether you're holding them in your hands or a bar on your shoulders or back or something, you're going to have to activate more muscles to do the exercise. And as you get more tired, your body wants to do this even more. Then you start to recruit the wrong muscles. And if you have a knee problem, that's not good, because you don't want all the muscles to get stronger if the root problem of your knee issue is a muscle imbalance. The most common cause for meniscus problems, arthritis problems, chondromalacia patella, patellofemoral pain syndrome, bursitis, tendinitis, is that your quad muscles are way too strong and your glute muscles are way too weak. The back of the glute, not the side, the back. And if you're doing banded squats or banded lunges or some exercise where you feel more the side of your hip working, guess what? You're activating a muscle right here called the TFL, the tensor fasciae lata, which goes down into your knee, makes your knee want to turn inwards because it's turning the whole thigh bone, and it's going to make you use your quads more. It feeds into the root problem that's setting up your knee pain very likely. Runner's knee, IT band problems, it's the same issue. If you instead focus on doing lighter exercises that really get the muscle to burn that you intend to burn, so like the glutes, for instance, rather than just turning everything on maximally, then you're going to be more successful. Slow is fast. If you can slow down and pay attention and fire the right muscles, then you're going to make faster progress. And if you try to get everything involved, get everything really tired, it's just going to make things worse. Co-contraction is what you're trying to avoid when fixing a knee problem. So what should you do instead? If you're using bands for exercises right now and you have a knee problem, instead, what you need to focus on is getting your glutes fatigued. And the first step to do that is making sure that you can even activate your glutes. Just sitting down right now or standing up, lying down, whatever position you're in, don't move. Just think to tighten up your glute muscles. If you can tighten up your glute muscles and your thigh muscles are not activating and your hip muscles on the side, like the front pocket muscles here are not activating, then you're good. But what happens in most people with knee pain is they try to activate their glutes and they feel their thigh muscles working. The muscle right here in the front pocket area, that TFL muscle, also starts to work. If you have a propensity or if you're likely to use these muscles when you do exercises and then you put bands on top of that, you're just going to be training those thigh muscles and that TFL muscle, and it's going to be promoting bad forces down at your knee joint, and you're going to be missing exercising the glutes like you should. So first, just turn on your glutes. Right now, in the position that you're in, if you had trouble with that, just practice flexing your glutes and keeping these other muscles calm and quiet. You might need to be doing that for weeks. In some cases, some people months, especially if you're in your older years in life, your 60s, 70s and beyond, and this has been an issue for a long time, and you've got an issue like knee arthritis, your glutes might be very shut down, and it might take you a long time to get them to the point where they're active. I've even had some people that don't think that it's possible for their glutes to activate anymore because they've forgotten what it feels like. It's been decades since their glutes were active. So start there. That'd be the first thing that I would fix. Get your glutes turned on and activated so that they're prepared to work in other exercises. Once you're confident that your glutes are active and your thigh muscles and your TFLs and taking over, then the next step is to do some light exercises that allow you to focus and tire out your glutes. Because if you're doing an exercise that's a little too hard for you and all the other muscles are activating as well, you're feeding into the problem. Only after you're confidently using your glutes on, say, like a bridge exercise, a mini squat exercise, some sort of focused hip extension exercise where you're moving your leg backwards like this, only if you're confident that you're using your glutes and you can tire it out consistently and you have control over your glutes, then go into the more advanced exercises like weighted squats or weighted bridges, hip thruster type motions. Those lunges are another potentially good exercise for you depending on your situation. Those exercises are truly advanced for most people, and throwing a band on is ultra advanced. If you want more help on what to do for exercises to fix your knee pain, check out this video here. It's called What Nobody Is Telling You to Help You Fix Your Knee Pain.